Do you think or rather fear that bodies of persons who die of COVID will transmit the disease? If we go by a recent study by All India Institute of Medical Sciences, there is no need for that worry. The study has found out that transmission of the infection through the dead is highly unlikely. Coronavirus doesn't remain active in nasal and oral cavities 12 to 24 hours after the death of an infected person, as a result of which the risk of transmission from the deceased is highly unlikely. AIIMS Forensic Chief Dr. Sudhir Gupta said. A pilot study was conducted over the last year in the Department of Forensic Medicine at AIIMS on COVID-19 positive medico-legal cases which were subjected to a post-mortem. Around 100 bodies were retested for coronavirus infection in an interval of 12 to 24 hours after death, and the result was negative. The virus does not remain active at all in nasal and oral cavities 24 hours after death, Dr. Gupta told PTI. The risk of transmission of coronavirus 12 to 24 hours after the death of an infected person is unlikely, he said. Reports of locals stopping families of COVID victims from performing last rites in the fear of transmission emerged several times during the pandemic. Since the beginning of the pandemic, experts have repeatedly said transmission of the infection is unlikely from the dead. Last year in March, a senior health ministry official said there is unlikely to be an increased risk of infection from a dead body of a coronavirus patient to health workers or family members who follow standard precautions. News Desk, Kaumudy, English.